Hopefully you can see that. It's called the Health Language Matrix, and I know a few of you have seen this before, but I wanted to share it again in this context because I think it can be useful. Um, the main reason I developed this tool is to help healthcare professionals, researchers, clinicians to engage with parents, families, patients in a way that does no harm, essentially. There's a lot of unintentional damage being done to relationships, I think, because of the words and phrases that are being used. And it's not anyone's intention, but it's sometimes just how things land. And so understanding different kinds of communication can be really important when it comes to engaging with a population that you might be a little bit afraid of working with, knowing that you're going to be bringing up big emotional topics can be really scary as a researcher. So let's just quickly talk about this. So we have these four axes, the positive, negative, jargon, and informative axes, which creates these four quadrants of different kinds of language. And in this first quadrant, the positive jargon quadrant, this, I think, is probably the most likely kind of communication that you might find yourself delivering if you're unsure, if you're new to research and you're new to creating research projects or thinking of engaging in co-design. When there's big emotions coming up and you don't want to say the wrong thing, you often end up leaning towards maybe a toxic positivity or like a cliche or something that is a little bit fluffy, and it can come across as patronizing. So, for example, you might say things like, well, at least your child's in a better place. Something like that. You've probably heard this before, you might have experienced. I know I definitely experienced it after Evie died, and it wasn't meant to cause any harm, but it made me feel like that other person thought that being in my arms wasn't the best place for my child, that there was somewhere else better for her to be, not with me. And so you get the sense that it can add a layer of unintentional, unnecessary harm. And then we have the jargon negative quadrant, and a lot of families would have received a lot of big words, big diagnosis words in their time with their children. But also, there's a lot of big, scary, confusing words in research, even just words like qualitative and quantitative and data and I don't know, there's a lot of words and I'm still learning them as well. And some of them I'm like, I don't even know what that means, or just the different way graphs are presented, different kinds of graphs. And especially if you're a researcher or a medical professional, some of the clinical language or the medicine language or the research language you've learned, it rolls off your tongue and it's a natural language that you speak. But for a parent or a family or someone with lived experience, that might be confusing. The thing with confusing language is it can also do a lot of unintentional harm. When you're confused, you don't know what's going on. It introduces an element of uncertainty, and when people are uncertain, that can be quite triggering and it can lead to people feeling out of control. Can lead to people feeling angry or upset or disempowered, and those feelings can then turn into behaviors. So, anger and with uncertainty or fear essentially can show itself as your cohort being withdrawn, or they might be aggressive, they might shut down, they might leave your project, and you might not even know why, but chances are there's been a misalignment, unintentional confusion, things not being shared in a way that's clear, essentially. So really important to look out for those confusing kind of words in your work when you're setting up a research project, to make sure that everybody understands. And we'll get to how we do that in just a second. Then we have this negative informative quadrant. And I think in research, there might not be quite so many of these examples. Definitely in healthcare, there are a lot of examples of this kind of language. But the people that you might be working with or engaging in your research will probably still hold scars, emotional scars of this kind of language that has been used in their experience. So even just, we've mentioned it slightly today, the word consumer. I know a lot of bereaved families, myself included, really does not like being known as a consumer. It's not something that it doesn't feel right. And I know that it's kind of a word that is maybe it's been adopted now and it's got legs and it's grown into this big thing, but the lived and living expertise and experience is definitely a nicer term. I know that it's more words and we like to be brief and efficient in our language, but it can cause a lot of unnecessary harm. Other words can be things like, their child might have been labeled abnormal or defective, mutated, dysmorphic, incompatible with life. There's a lot of big destructive words, especially associated with life-limiting conditions, that you won't know that these families are carrying those wounds from. So it's really important just to be aware of what they've heard and seen and have experienced in the past. But look, there is hope. See this shiny yellow quadrant here, this empowering communication. This is all about being clear, kind, and curious. So, what I mean by that is it asks a lot of questions and it seeks to align what you're hoping to do with your research and what the parents and families and lived experience representatives want to share. And it's about making sure that there isn't confusion, that there is clarity, that there's ability to ask questions, and that nothing is seen as being stupid or off the table, that everything is valid and important and safe, essentially. So that's what I mean by that. And so what I've done is I've been thinking about the kinds of questions that you as researchers or potential researchers might need to ask um, those that you are interviewing or working with. Oh no, let me see. There. So here's just a few that I've kind of come up with, and hopefully this sparks some further thinking on your parts. But I think having an idea of what you need to know from the people that you are working with in this research project could be really useful. So here's just a few. So imagine kind of having your first meeting with your cohort of um, lived experience expertise, asking something like, what would help you feel comfortable and respected in this research or co-design project? And then have a discussion around that. So you're, as a group, you're setting the rules of belonging, essentially. You are establishing how are we going to work together for the benefit of everybody. And I think sometimes, and we were talking about this a little bit before we jumped on, there can be like a them and us sort of a scenario, the researcher and the lived experience or the consumer. And I think the more that we can be human towards each other, and find our sameness and find our connecting points and find out how we best work together, that creates a sense of equality and safety and support that naturally occurs when people feel like that hierarchy isn't there and that people are really being truly heard and seen. Which goes to this next question. What would help you feel that your experiences and perspectives are truly seen and valued by researchers? And these answers that you get then creates again that sense of, well, this is how we're going to behave, this is how we're going to support each other, and this is how we are going to continue this research project. What does it look like for you to feel genuinely heard when sharing your experiences? And then even further, the fourth question, are there any boundaries, topics, or approaches that researchers should be mindful of to ensure participants feel safe and supportive? So hopefully this is useful, but I think having like I said, there's no script, but there are things that you can build into your beginning that can set you up for the best success to work together to make sure that everybody feels safe and supported, because it brings up a lot of emotions for everybody, the researchers as well. There's one down here that I really like, especially around culture and religion. You're never going to be able to know everything about a person. So asking these kinds of questions can be really empowering for you as a researcher to know how to support somebody, because you can't just assume that everybody needs the same thing, and you might have participants who need a certain way of doing things and others need a different way of doing things, but you won't know that until you ask these questions. So even how would you like researchers to communicate the purpose of the project and help me understand how best to support you as you participate in this research? And then this last question I think is really, really important. If unintentionally some harm has been done, some damage has been caused, you've gone off you're not on the same page anymore, before you even start, I think it's really important to know, how will we repair any unintentional harm when things get hard? How will we look after each other? What are the steps that we can take to make sure that we look after each other and support each other, because this research is so important. So it's about creating those, like I said, rules of belonging and rules of participation that truly does support everyone involved. And I have another little framework. This is what I use this a lot in my communication training with healthcare professionals, and it's a nice framework of the kinds of questions that you might need to consider. So, especially in this kind of work as a researcher, I think families really they engage in research for a number of reasons, and even just asking that at the beginning, why are you attracted to being part of this research, or what's driving you to be part of this? And some of it might be that they really want their child's legacy to live on in some way. They want their experience um, to make somebody else's better. It might be that they want to find some sense of purpose in their experience, that something good is coming from this experience, like a death of their child, or the potential death of their child. So being able to ask them questions like, what are you proud of, or what have you learned through this experience of being a parent or a family member or a caregiver? What do you hope for the research? So ask them questions like, what would be an ideal outcome for you once this research is completed? What are you afraid of? You could ask things like, what are you concerned about? And that, I guess, speaks to, it could be, well, maybe this is going to be too emotional for me, or what happens if I'm not available? So you ask lots of different ways of asking these questions. Essentially, these 4 questions are often too big to be answered, and so when I talk about communication with healthcare providers, I encourage them to think of as many different, more nuanced ways of asking these 4 questions, as a way to bring alignment and support into the space. And then that last question, what do you need? Which speaks to some of those questions from the slide earlier. How can we best support you? What does good support look like? And those kinds of questions. And again, this resource will be available to you. I didn't come up with a whole lot of questions because I didn't know everybody's research projects, but I thought hopefully these give you enough of a platform to jump off from on your own when you come into co-designing your own research projects, to build some of these as scaffolds into your work to help you communicate and help you design your research, and to help you engage as best as possible without that unintentional harm caused. So I think that was the end. I'm going to stop sharing. That was me.